Apothecary Podcast. Authentic chat about medicines, pharmacy and healthcare in the UK.
Pharmacists Jamie, Gimmo and STC take on topical and controversial stories but keep it edgy yet light-hearted.
Pod guests share their desert island drugs and joyful patient stories.
Welcome to episode 10. My name is Jamie Hayes. This is the Oral Apothecary Podcast. Coming up in today's episode, we're joined by Sam Quaye. Sam is a pharmacy technician at Bart's Hospital in London, where she works as a business and performance manager. We will hear from Sam in a moment as she shares, for the last time for this season of the Oral Apothecary, her desert island drug, her career anthem, and recommends a book for the Oral Apothecary Library. Our micro discussion this episode will look at innovative ways of improving medicines adherence, including the results from a remote medicines management service in Liverpool. More on that later in the pod. Let me welcome my fellow apothecaries. STC is in Bournemouth and Gimmo is in Cardiff. Welcome both.
Evening.
Evening.
What have you been up to? Any news for me?
I'm going to start with a bit of a rant, if that's okay.
Ooh, rant away.
Go ahead.
I'm going to say 4 words that anyone who works in the NHS is going to strike fear into their hearts and probably ruin their evenings.
Oh, go on then.
Statutory and mandatory training. I've spent the day trying to do my stat and mandatory training, which has involved a couple of hours trying to log in, a couple of hours trying to find the relevant course, and then only to find the course didn't work. So a few hours out of my day when there's a global pandemic going on, and I still don't know how to lift a box up properly. I was feeling quite wound earlier on today.
I know what you mean about that, but I get quite irate as well about this, but in a different way, because people say to me, well, we haven't got time to do mandatory training to learn about medication safety. I say, well, what do you mean? Do you not think the public would want to think and know that you have every now and then been brought up to speed with all the things that you need to know about medication safety? Do you not think that a pilot has to go every 6 to 12 months and prove that they can take off and land? And so, yes, you need to sort out the IT, of course you do. But actually, the old idea of mandatory training, I think, does need to be modernised in the NHS. But I agree with your hassle of getting in and out.
This was manual handling, not medicine safety.
Okay.
If it was medicine safety, I would have loved it.
Yeah. No, but do you see what I'm saying? Other people will say that they don't think it's relevant to them, but actually it is. So I'm thinking about maybe doctors and medication safety, for example.
Anyway, look, this is episode 10 and our final show of the first season. So together with our Six Nations special, that makes 11. And we all know why that matters so much. 11. What are your highlights, apothecaries, of the first season?
Oh, that's very unfair, James. You could have given us due warning that you were going to ask us that. That's like, asking who's your favourite child. Or the other way round, my children were once asked, who is the least annoying parent? And my wife was distraught to discover that I was the least annoying parent. And if you know me, that's really bad. For her, not me. But yeah, so that is a really tough question. Well, as you know, I love music and I love the fact that we've got this playlist together. And actually somebody did ask me, wish you could play, even 5-10 seconds. And actually we know we can't because of rights and things. But just to make it absolutely clear, if you go to Spotify, even if you only use the free membership, you can go to and type in Oral Apothecary. And not only do you get the podcast, but you'll get the playlist. So it's just to say we've had a great variation of tracks. And I suppose keeping with that theme, I'm going to pick a mirror with what I found absolutely fascinating was this idea that in the 1980s, the music mimicked the heartbeat of the MDMA, 140 to 160 beats per minute. That absolutely blew my mind. I didn't realise that was the case. So that's going to be my highlight. But of course, everyone was brilliant.
Very good. Gimmo?
Yeah, no, it's just been good fun, hasn't it? It's something we've been talking about for a number of years, Jamie, and I know you've been talking about Steve. Obviously, meeting you, Steve. People may not believe it, but we didn't know each other really before this.
True.
So that's been good.
Yeah, only virtually.
If these things take me down some paths, I never thought it would result in meeting a British Lion, even though it was virtually. I enjoyed Ravi last week. Like I said, like you, Steve, all the guests have been fantastic. Ravi had a real passion for his subject. You could see his eyes light up when he was talking about pharmacogenomics. When someone's passionate about a subject, and it goes for all the guests really, you can sit back and just bask in it and listen all day, can't you? So I really enjoyed listening to Ravi. But like you with the music, I've enjoyed discovering some of the books. So, the Invisible Woman book that, was it Claire recommended? It was a bit of an eye-opener for me. The fact my mum is enjoying the show, that's good, because it gives us something to talk about. And I've got a long list of books to read and I'm looking forward to reading them.
Very good.
What about you, James?
Oh, well, for me, it's, I've gone general general with the guests, really, because we said at the outset that it was the guests that will add the class and culture to proceedings, and that certainly proved to be the case, hasn't it? I think we realised what we were trying to do was tease them down to our level. We don't always manage it, but I think that for me, it's when we finished recordings, and for the listeners, this is going to be tough because they don't get to hear these bits, but it's after we finished pressing record and our guests relax. That's when the real treasure, the gems, the nuggets and the pearls come out. We need to do something with that. I think we need to go back to all of our guests over the first series and ask their permission for some of the outtakes.
Oh, you mean like an explicit outtakes kind of?
Yeah, some of the outtakes, because there's some great stuff in there. The feedback that we've had from listeners has been great about how we've made people feel connected during, difficult times. I hope it's brought a smile to people's day, maybe some laughter. They're allowed to laugh at us, and I'm sure many people are, but it would be great if they could laugh with us.
I'm welling up, Jamie.
It's very emotional. Last day of term.
Very good for my mental health, I have to say. It's really given me a pep doing this for the last few months.
Yeah, I agree.
Okay, let's welcome our guest. It gives me great pleasure to welcome Sam Quaye. Sam is a pharmacy technician who has worked in community and hospital pharmacy, education and regulation. She's co-founder of the Pharmacy Technicians of Colour Group, a fellow of the Association of Pharmacy Technicians UK, and an elected public governor for Guy's and St Thomas's NHS Trust, where she is chair of the Membership Engagement and Communication Committee. As I mentioned earlier, Sam's day job is Pharmacy and Business Performance Manager at Barts Health, where she's also involved in staff diversity and wellbeing. Welcome, Sam.
Hello, thank you for having me.
Thank you. Welcome. What's on your agenda at the moment?
So in my inbox now, bar COVID, I think was the brief, but this links to COVID, is staff survey. So within the NHS, the staff survey has just come out. The 2020 results have just been published. So on my agenda is thinking about the next steps and what we're going to do. That is what we're actually going to do is be holding some listening events to play back what we've heard from the survey and work with our team to co-produce some solutions. So that requires lots of facilitation and really listening to what people want to do.
You've just reminded me, Sam, that's brilliant. I sat on a webinar earlier this week where I heard this quote, and it was from the chief exec of Gallup, the big employee engagement company. Your manager has more impact on your health than your doctor.
Discuss.
And then they went on to say, do you like what you do every day? Is time with your manager the worst part of your day?
So, Sam, is this based on the survey, in other words, for staff who've been working during the COVID year?
No, so this is an annual survey that happens in secondary care every year, just to kind of get it's like a barometer of how people are doing within the NHS.
Yeah, no, I'm familiar with that, but I meant, were they asked for their views? Because sometimes they come out the year after, don't they? So I'm saying, were they asked from the year that they were working in COVID?
Oh, yes. So these are the 2020 results.
And were they vastly different from last time?
Unsurprisingly, probably, because of patient flow and activity decreasing. One of the questions is about whether you have suffered physical harm or abuse from patients. And that's gone down significantly because there's no patients in hospital there. And those that are there are not very well at all or haven't been very well at all. So from that perspective, yes, it's changed. And I think probably thinking about people's mental health and well-being. So definitely COVID is kind of linked in there. So like previously people would have asked for our well-being, can we have a new microwave, for example, in previous years. I think this year is much more things like, can we have mental health first aid? Can we have some support to deal with the things that we've seen during COVID? And I know we wanted to keep this upbeat and it is the final series, but I think that it's important that we think about those things for the people. I think going back to previous episodes where you had Lindsay Harper on, she was talking about rest and recovery and us not getting that rest period before the recovery. And that, I think, is the space that we're in now. So I think it's really important for us to just pause, however briefly, to reflect on that.
And I think it's interesting. We made a decision at the beginning of the podcast not to keep away from COVID, but not to make it COVID focused, because it was obviously a reality we're all living. But it's interesting that it's popped up time and time again. And the theme that's come through is what you've just said, Sam, is resilience, is tiredness, is the need for recovery, because we're all feeling it. And probably everybody listening to it is feeling it. And it's great to hear actually that things like the staff survey being used for this, because I mentioned last week I'd been on a talk about compassion and they were talking about the need to listen to staff. You can have surveys, it's what's done with the survey that's important, so it's heartening to hear that you are taking it seriously and doing stuff with it, because sometimes it can feel like there's a bit of lip service paid to these sort of things, because I think it's particularly important this year that we listen to what people are saying, because I think it's going to be once we come out of the fight, that's when the real fatigue sets in. And so it's next year that's going to be, in a way, tougher for a lot of people because they're having to deal with what they've seen.
I think there's a few things in there that you kind of have brought out. So again, going back to your first episode when you were talking about, was it Compassionomic, the book, and thinking about mandating healthcare professionals to be compassionate. And I don't think you can have that blanket rule. You can teach compassionate behaviour, but I think it's innate. If you have that empathy, it's an innate thing. So to be authentic, you really do have to care about the people. And I don't know whether you know, so for the staff survey, the workforce race equality standards, the majority of those come from the staff survey, the questions. So it links directly in, and given everything that's happened in the last year in terms of Black Lives Matter and the fact that racism and anti-racism has moved up the political agenda, the staff survey also links in there. So it's so important, all the results that have come out. And it's really important for us to listen to people and find out what they want to do as solutions rather than telling them what should happen and doing something to them. It's really about that whole co-production.
Yeah, the thing about that compassionomics, the exact point of this, which is if health professionals burn out, then their ability to be compassionate on a more frequent basis becomes more difficult. And I think that's what you're saying, isn't it? And that's what we're all hearing. And those of us who are working within the NHS are feeling, because there isn't going to be any recovery. We're just going to have to crack on with all the stuff that we've got to do. Does that talk to, obviously, as a pharmacy technician, and all of us as pharmacists on the 3 apothecaries have worked with some fantastic pharmacy technicians throughout our career. We were discussing it before you came on. It's that team approach, and the same thing we discussed with Lawrence Brad about him saying that he felt that having pharmacy technicians and pharmacists in general practice was helping his mental well-being and his resilience. Do you not think that that whole team approach thing is what makes the pharmacist and the pharmacy technician, are you working in acute trust, but it's going to be similar in other places, isn't it? They've got to work together as a team, right?
Absolutely. And you spend, I think you talked about this before as well, but you spend more time in your working day with those people than you do with anybody else, even your family sometimes, particularly in the recent months, because people have been working much longer hours. So it's not just pharmacy technicians and pharmacists, it's the whole team. So we've got our admin teams, we've got our pharmacy assistants, we've got the people who work in quality, so our healthcare scientists. This is in secondary care. And in primary care, you've also got the people who, whilst they don't always get the shout out, it's people who have been working from home during the pandemic in commissioning and other places, and all the medication safe, the kind of what would probably be termed back office functions, but actually are super important and also make pharmacy what it is.
Absolutely.
Sam, can I ask you about your public governor role? What, looking through that lens, what does that bring to your working week or month?
So I've really absolutely loved my public governor role, because you are then thinking about healthcare from a completely different angle. So I'm a public governor, meaning that I live locally to the hospital that I'm a governor of. And so it's thinking about how the trust serves the community that it sits within. And so from a perspective of thinking about the bigger picture, that's really helpful for me to kind of step back. And yes, in my day job, I'm kind of involved in the day-to-day operational delivery of different things. But from a patient perspective, when I'm not, or a potential patient perspective, it's really kind of a different lens to look through. So thinking about engagement, do they truly represent the local community? Do they truly listen to what the community needs? Or is it based on data that's kind of generated within the trust? Is it inward focusing? And arguably, and maybe I'm biased, but I would say that Guy's and St Thomas's is fantastic for that. So it does have that outward facing, and we are trying to improve that all the time.
That's because all the MPs get taken there, right?
I mean, I'm not going to lie, that is true.
I got you. No, I'm joking. Yeah, so I worked in London. In fact, I didn't tell you this, but I started my career at Bart's Hospital, where you work now. Uh-huh. I walked through Smithfield Market with all the 80-year-old fellas wearing their smocks, from their overnight job, pulling pork and beef and everything through. It was an amazing place to be at the time. But yeah, enough said about that. Thanks very much for that, Sam. And the other reason for being on the Oral Apothecary, as you will well know by now in episode 10, could you give us and our listener a desert island drug?
Indeed, I can. I'm really excited about this one. So before I disclose my choice, I just wanted to remind the listeners that the brief is a drug that evokes powerful memories for you, and not medicines that would be helpful for survival on a desert island, because my drug of choice is not that. This is really difficult to decide, because I thought about sharing the first checking error that I ever made. So that drug, I thought, was that something that you never forget?
Adrenaline has just rushed through my body, Sam.
We could all give ours right now, but come on, tell us yours.
Exactly. But that's not what I'm picking.
Oh.
I was just luring you